All right, today we're going to talk about something that's pretty much a rite of passage for parents. That dreaded call from daycare or that weird rash you just noticed. We're talking about hand, foot, and mouth disease. So let's get right into it and figure this thing out.
You know how it starts, right? Your little one has a fever, they're super fussy, and they're just not having it. And then you see it, a weird rash in some pretty strange places. And just like that, you're down a rabbit hole of online searches, wondering what on earth is going on.
And yup, this is probably what you're seeing. These little blisters or red spots almost always on the palms of their hands or the bottom of their feet. I know, it looks really alarming, but this is the classic telltale sign of a super common childhood illness. This right here is the hand part of hand, foot, and mouth disease.
Okay, so let's clear this all up. What exactly is hand, foot, and mouth disease? You'll hear it called HFMD for short. We're going to break it all down, what it is, where it comes from, and what you really need to know.
So, at its heart, HFMD is just a viral illness, and the main culprit usually has this kind of memorable name, the Coxsackie virus. It's part of this big family of viruses called enteroviruses, and it's the little bugger responsible for that fever and rash that's got you so concerned. The name is actually super literal. It shows up on the hands, the feet, and in the mouth. Sometimes you'll even see it on their bottom or in the genital area. And listen, here's a really important thing to remember. This has absolutely nothing to do with the foot and mouth disease that affects farm animals. They're totally different things, not related at all.
All right, the big question. How did this happen? How did your kid even get this? Look, understanding how it spreads is everything, because this virus is incredibly contagious, especially in those little kid environments. So the virus goes on this little journey inside the body. It gets in through the mouth, unwashed hands are usually the ticket in. Then it sets up camp in the throat and intestines and starts multiplying like crazy. From there, it hops a ride on the lymph system, kind of like a highway, and eventually makes its way to the skin. And that's when you finally see the evidence, the rash and the fever.
And this number, this explains everything. Over 90% of cases are in kids under 5. That's why it just rips through daycares and preschools. I mean, think about it. Their immune systems are still figuring things out. They're all over each other, sharing toys, touching everything. And let's be real, they're not exactly experts at washing their hands yet.
Okay, so you're pretty sure it's HFMD. Now what? What are you going to see, and in what order? The good news is it follows a pretty predictable timeline. Let's walk through it.
So first, after they're exposed, nothing happens for a few days. That's the incubation period. Then you'll get that low-grade fever and just that general I feel yucky vibe. A day or two later, the really tough part starts, the painful sores inside the mouth. That's called an enanthem, by the way. And right after that, the famous rash appears on the hands and feet, the exanthem. But here's the silver lining. The whole thing usually peaks and then starts getting better within about a week to 10 days.
Now, a lot of people immediately ask, wait, are we sure this isn't chickenpox? It's a fair question. The biggest difference, the itch. HFMD rashes usually aren't itchy at all, while chickenpox is, well, famously itchy. And check the location. HFMD almost always hits the palms of the hands and soles of the feet, places chickenpox usually leaves alone.
All right, diagnosis is in. Now for the most important part. What do you do about it? Well, there's no magic cure for the virus itself. The whole game plan is just managing the symptoms and keeping your little one as comfortable as possible while their own body fights it off.
So supportive care is the name of the game. That means things like acetaminophen or ibuprofen for the pain and fever. Hydration is absolutely crucial, but those mouth sores can make drinking hurt, so stay away from acidic stuff like orange juice. Think soft foods, yogurt, applesauce, smoothies. And of course, lots and lots of rest. Let their body do its thing.
And listen, if there's one thing I want you to take away from all this, it's this quote right here, straight from the research. For almost every kid who gets this, it's a mild thing that just goes away on its own in about a week. It's a rough week, for sure, but it will pass.
Okay, now, deep breath. We've said it's usually mild, and it is. But it's also really important to know what to watch for, just in case. Complications are super rare, but they can happen. This isn't about scaring you, it's just about being prepared.
So here are the red flags. The biggest one to watch for is dehydration, because those mouth sores make it really hard to drink. If you're not seeing tears when they cry, or you're seeing way fewer wet diapers, that's a call to your doctor. Same goes for a really high fever that won't break, if they're super sleepy and you can't wake them, or, and these are immediate medical attention things, seizures, a stiff neck, or trouble breathing.
The reason we watch for these things is because in very, very rare cases, some strains of the virus can cause more serious problems, like aseptic meningitis. I have to say it again, this is not common, but it is why we keep a close eye on them and always trust our gut as parents.
Okay, let's finish up on a positive, proactive note. How do we stop this thing? How can we prevent it from coming into the house in the first place, or at least keep it from taking down the whole family? Okay, here's a wild and really important fact. The virus can actually hang out in a kid's poop for weeks after they seem totally fine. This is huge. It means you have to be super careful with hygiene, especially with diaper changes, long after all the other symptoms are gone. So knowing everything we know now, that it spreads through saliva, blister fluid, even poop, what's the single most effective thing you can possibly do? All the science, all the studies, they all point to one incredibly simple, powerful answer.
Hand washing. Seriously, that's it. It's that simple. Just good, old-fashioned, thorough hand washing with soap and water. It is by far the best weapon we have to stop this virus from spreading.
And that kind of leaves us with one last thought, doesn't it? This is really a community thing. Now that you know how it travels and, more importantly, how to stop it, it makes you think, could better hygiene, could all of us being a little more careful actually stop the next big outbreak at your kid's daycare or school? Something to think about.